joining us. Merci d'être parmi nous aujourd'hui. My name is Kendra Titley and I will be your moderator. Je m'appelle Kendra Titley et je serai l'animatrice de ce point de presse. Before we begin, a quick reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. Available for questions from the media, we have disponible pour répondre aux questions des médias nous accueillons in Council Chambers Mayor, le Maire Jim Watson, and Steve Kanalakis, City Manager, Directeur Municipal. And phoning in today we have Councillor Keith Eglai, Chair, Ottawa Public Health Board, le conseiller Keith Eglai, Président du Conseil de santé d'Ottawa, Dr. Brent Malachny, Deputy Medical Officer of Health, Médecin adjoint en santé publique, Anthony Demonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence, Wendy Stephenson, Chief Financial Officer, Chef des Finances, and Stephen Willis, General Manager, Planning, Infrastructure and Economic Development, Directeur Général de la Planification, de l'Infrastructure et du Développement économique. I will now invite each agency to ask their question. You may ask one question with one follow-up. Par ordre alphabet.
By alphabetical order, I would like each agency to ask their question and a follow-up question.
If for some reason we lose you during the call, please try phoning in again or contact Media Relations to submit your question. We'll now start with, nous allons commencer par Kate Porter, CBC Ottawa.
Hi, thanks everybody. My first question is for the mayor. I was wondering, given the city's going the route here with two co-chairs, I wonder why you personally would have chosen, for instance, not to vote for Jeff Leeper, just given there's been criticism in the past of a lack of urban representation both on planning and FEDCO.
Well, I have full confidence in Councillors Moffat and Gower. I think they bring two different perspectives. One who's a veteran member of council and another one who's a new member of council. And the very fact that, as you know, Kate, the planning committee is the workhorse committee. It has a lot on its plate, both planning applications on a regular basis every 2 weeks, and then, of course, the official plan, which is going to require a tremendous amount of time and effort. And the majority of members of council did, in fact, vote for Councillors Moffat and Gower, as did I. And I'm very confident that they will do a very good job in the last year and a half of this council's mandate. Thank you.
Okay, thanks. And my second question is both for you, Mayor Watson, but also if Mr. Willis was able to add anything. I'm just going through this memo about the official plan, and it does note that the location of the Taywin lands doesn't appear to align with the 15-minute neighborhoods or proximity to LRT. And I wonder, do you think the inclusion of Taywin in the urban boundary needs to be revisited, just given, the city, of course, needs the minister to approve the OP?
Yeah, Mr. Willis.
We just received those comments on Friday and haven't met with ministry staff, and I note that those comments were quite different from the other ones where they asked us to make specific changes. The ministry did not ask us to change the plan in their comments. They just asked us to have regard to the financial implications, which is consistent with now 3 different motions our own council has said to us as well as we bring the plan forward. So we'll have to clarify what the ministry intends, but I don't think that's the signal they're sending.
Mayor Watson?
Yeah, I can say as a former Minister of Municipal Affairs and Housing, these things go through the process. There's a lot of back and forth between a city and the planning staff and the planners at the Ministry of Municipal Affairs and Housing. This is completely normal process that was followed when I was there at Queen's Park and is being followed now. And as Mr. Willis indicated, they're not giving us direction not to do something. They're asking us to look at certain aspects. And that's the whole purpose of getting that feedback early on from the ministry. As I said, it does go back and forth, and ultimately the minister has to sign the official plan after council's approved it. Thank you.
Thank you very much. We'll now go to Eric O'Brien at City News Ottawa.
Good afternoon, everyone. I can't remember if Mr. Demonte is on the call. I'd like to hear Dr. Malachny and maybe Mr. Demonte, if he's on, just your take on removing the state of emergency in the city. I mean, there's really positive. It's a really positive situation that we have in the city right now in terms of COVID-19. But is there even a possibility? Because we hear warnings about the potential effects of the Delta variant in the future. Is there a possibility that we may need this, like emergency measures in the future again?
So maybe it's Anthony DeMonte. Maybe I can start, and if Dr. Malotny wants to add. So the use of the state of emergency is a tool that municipalities are given. The head of council, the mayor, can invoke that, and it did give us a certain tools that we don't normally have. We can do procurement quite rapidly. We can reassign staff throughout the organization. Our emergency operations center and our senior leadership team with the city manager is mobilized, and we can focus all our resources on an event. Based on the key public health indicators as they are today, and the vaccination rates both provincially and here locally, and we're ahead, and we continue to improve here in Ottawa. Those tools are no longer needed. So just to your point, I want to be clear, while we're no longer in a state of emergency, we're in activated operation. So that means that our emergency operations center and on all the work that's being done continues to be done, and we continue focused on our objectives. It's like one level below a state of emergency. So things that, we have special authorities to do buying without, some of the procurement requirements are no longer there for us. But I think it's an appropriate move, and that's why we recommended this to the mayor to step down, and he accepted our recommendation. It's an appropriate move of where we are in this operation. At the same time, you saw I hinted a couple of weeks ago that we'd be closing certain of our mass vaccination, so we're getting away from that. And I suspect, as I'm messaging now, in the next few weeks, we'll continue to step that down, and we'll be moving from a true emergency operations back to public health leading this as they have the expertise in some of the areas. So this is a very normal thing. And then just to finalize, we can easily go back into a stage of emergency if it's required, but being in this level of process, we have a lot of tools, and we continue to be fully mobilized to respond to this situation. I don't know if Dr. Malotny has anything he wants to add more from a clinical perspective.
Yeah, no, thanks, Tony, for that overview of the what this does, in terms of city operations. From an Ottawa public health perspective, it doesn't change what our focus is. Our focus has been for the last year and a half to support and respond to this pandemic to protect the people of Ottawa. And, this pandemic is not over. We've seen what has happened in other countries as they have, begun to remove restrictions, and we've seen rather large resurgences, such that they're needing to reapply some of the restrictions. And just to put it in perspective, remember when we were at our last peak and we were, in case counts in the mid 300s on a daily basis. Well, if you look to the UK or the Netherlands, they're in the 400s, and in the case of the UK, which is now approaching 500 cases per 100,000 per week. So these are rather massive resurgences that are being seen in other countries. In the UK, the resurgence has been going on long enough that we're now seeing hospitalizations increasing on a weekly basis. So I can tell you here at Ottawa Public Health, we are very much remain focused on this pandemic. We are actively planning for the fall and actively supporting schools and businesses as they open or expand. But we need to watch what happens in other jurisdictions. We need to get as many people vaccinated as possible. If you have a second dose, if you already had your first dose and you've got a second dose sometime in the distant future, because we know some people are booked in the fall, please contact us or go online and rebook to get vaccinated now. If you haven't been vaccinated, please start doing so. It'll take 6 weeks, with 2 doses, with 4 weeks in between, and 2 weeks after you get your second dose to be fully protected. So you need to start getting vaccinated now to be protected in September. That'd be my basic message. The concern is Delta, and we need as many people to be vaccinated as possible to prevent transmission in our community. Thank you.
Yeah, very quickly. It's Keith Agawai, very quickly. I can just say the lifting of the emergency status doesn't mean this is over. It certainly isn't, and as Dr. Malotny said, there's still a lot to be done in the city and a lot of steps that people can take to protect the community, like finalizing your vaccination, getting that second vaccination, moving up your appointment. So we're ready, willing, and able to continue to do that work, and we'll continue to do that until this is over. But lifting the emergency status does not mean this is over in the city.
Dr. Maloney en français là-dessus, s'il vous plaît.
Sorry, I'm not going to be able to provide that in French, but our OPH media can assist afterwards.
Eric, do you have a follow-up?
I do. Actually, another question for Dr. Malotny. I'd like to get your thoughts on decriminalizing opioid addictions and what could that actually do for the opioid crisis in the city?
Yeah, no, thank you for that question. I mean, as we heard today at council and in other places, I mean the opioid epidemic is serious. It's gotten more serious during COVID for a whole bunch of reasons. People are under more stress. Access to services of all kinds have not occurred to the same degree as they normally occur. Even some of the COVID things where we want people, to maintain distancing from each other runs counter if one's, using opioids where you really need a buddy system in case you do overdose and your buddy can give you Narcan. So for a whole bunch of reasons, this situation has gotten much worse. As a really complex problem, there is no one single solution. There are a bunch of very important components that together can turn this tide, and it's by no means just OPH or municipal government, community partners, providers, people with lived and living experience. They're all really important to be working together on this. Today's motion that was passed by council is an important piece in terms of asking the federal government to look further at the issue of decriminalization. And as Chair Egli mentioned during council, we at Ottawa Public Health will have a comprehensive report coming to the Board of Health's meeting in September describing the comprehensive approach that we're recommending to address the problem.
Thank you.
Thank you very much. Next, we have Ted Raymond at CTV Ottawa.
Hi there. My first question, I guess, is for Mayor Watson, but I think Mr. DeMonte may have something on this as well. I'm just curious about the temporary mandatory mask bylaw. As I understand, it's set to expire at the end of August, and council won't be meeting again to renew that until after the expiry date. So are you basically just kind of like letting this lapse? And what does that happen for people, like if there's no more mask bylaw in place municipally?
Yeah, thanks, Ted. I'll ask Tony to give you the specifics, but we still have a mask bylaw, and there's still a provincial mask requirement. And I'll ask Tony to explain the difference between the two and what happens at the end of August.
Yeah, thank you, Mayor. So I think important point is we had done the initial mask bylaw when public health had identified that was a need, and at that time there was no provincial tool for us to use. Then the province did put in the provincial regulations, and since then we've actually been using the provincial regulations in spite of our bylaw being renewed. In consultation with our public health colleagues, we feel that that provincial regulation is sufficient and gives us sufficient tools, if required, to ensure that people are respecting the public health measures, which include wearing a mask. So it becomes a little redundant right now. So as it stands now, that's correct. On August 26th, I believe, is the date. The bylaw will it has a sunset clause, so it will no longer be in force. We'll have the provincial tool. As we get into the fall, and Dr. Malotny started alluding to this, they're looking at what's going on in the world, what the situation here is in Canada and Ontario and locally. And if a tool after the 26th like that is required, and for instance, the province would have removed the regulations, we have several options. We can come back with that bylaw. If council's not sitting, we don't have to use that bylaw. The medical officer of health has a couple of options, including both a Section 22 order, which is a little bit more complex, but quite simply can provide instructions so they can identify areas where that may be problematic. I don't know, I'm just giving an example now, but let's say we identify restaurants were problematic or indoor gatherings were problematic. So they can order an instruction, which is enforceable, and in those areas, you have to wear a mask. So we are letting the bylaw expire on the 26th of August, and we'll continue to use the provincial tool. And if that tool is no longer existent later on and we need it, the medical officer of health has full authority to put in other tools for us to be able to enforce.
Thanks, Tony, can I just add a couple of things, and then maybe you can do in French? Does that sound okay?
Absolutely.
Okay, yeah. So this is Dr. Malafi here from Ottawa Public Health. So just to add to the answers that have been given, I mean, it's important to take a step back and recognize that masking has been a very effective thing that we could do for each other to prevent transmission. And it became really important when we realized that this disease is transmitted by people without symptoms. So in other words, people around us may not even know they're infected and can potentially spread it. And masks work when most of us are wearing them. Certainly, at the moment, we still have, a large number of people who aren't vaccinated, some who are immunocompromised and cannot be fully protected by vaccine. So really, masking plays a really important role in protecting each other. And as Tony was saying, there are provincial masking provisions in the Step 3 regulations, and we don't know how long Step 3 will last for, and then we also don't know what provisions the government will do post Step 3. So in addition to the issues that we said we were monitoring in terms of not only the COVID experience here, but other places. So we're going to be keeping an eye on all of those through the next number of weeks as we approach the end of August. Thanks.
Okay. Donc, pour votre collègue en français.
So, in short, the municipal bylaw for masking will expire on the 26th of August. Remember that when we voted on that bylaw, is that because we didn't have any. There was nothing at a provincial level, so we needed a tool. Since then, the province of Ontario made have now some provisions for that. So the municipal bylaw is not needed anymore because we're following provincial bylaws. So what we'll do is we'll let the 26th of August approach. But if we see that the situation is worsening and that we have to re-implement the bylaw, we do have other tools. The medical officer of health can actually provide some specific instructions. Then our municipal agent will be able to apply our bylaw. So for right now, the tool is not needed anymore, so we can just let it go because we do have provincial provisions.
Appreciate that. My follow-up question is, I guess, for Mayor Watson, but possibly for Councillor Egli, maybe Mr. Demonte again. Just following up on the state of emergency and some of the comments you made previously, maybe you could just kind of talk about what this means, because I understand this is more of a city operations thing. If you could talk about what this means for most folks just kind of going about their day-to-day lives tomorrow. I mean, as I understand, the public health measures and everything like that are still going to be in effect. Is that correct?
That's correct. All public health measures are in effect. This is really an internal ability that the province gives the City of Ottawa, the ability to be more flexible in the midst of an emergency. For instance, during the emergency of where the flooding was, we didn't have to go out to tender to go out and get the sandbags and the sand and so on. We just went out and got it as quickly as possible. And the same with, for instance, our staffing here at the City of Ottawa. It gives the general manager and the city manager the ability to be flexible and taking staff from one division and putting them in another division, notwithstanding their classification. So it just gives a degree of being more nimble for our staff, that we can move quickly because we're in the midst of an emergency. We don't have to always go through all of the steps in order to procure products and supplies and so on. I don't know if, Steve, you wanted to add something else. Thank you.
Thank you very much. We'll now move on to Craig Lord at Global Ottawa.
Thanks very much. I think this would be a question for Anthony DeMonte. Was interested to see that the city is working with the Escapade Music Festival on a pop-up vaccine clinic. Can you talk a little bit about this strategy and if that's something that we're going to be seeing more of, the city going to where especially youth are to set up and deliver shots?
Sure, thank you for that. Yeah, so as you're seeing this evolution, and we've been talking over the last couple of weeks of, the mass vaccination clinics brought us to where we're at, and that was very effective. Now the operation is starting to pivot. We're seeing diminished need for mass vaccination, so we've closed some and we're moving, and those sites now have become back available for their core business, and the staff are going to be redeployed. So yes, absolutely, and I'm sure Dr. Malotny will have more to say on this, and I'll let him chime in after. But when you look at the data and the coverage rates, the 18 to 39 group continues to be the group that has lower vaccination rates than others. And if we want to continue to increase our vaccination percentages, because first doses now are kind of plateauing out at about 83%. We want to continue to increase that. It's going to be important to start having a much more focused approach instead of a mass vaccination approach. And this is not just in Ottawa, this is across the province. We're seeing the same thing. This is normal in this type of operation. Initially, you want to get everybody vaccinated, as many people as possible. Then after that, you have to continue to focus on areas. So yes, this initiative is exactly that for that group, and you'll see more and more of that. And as I hinted a few weeks ago about shutting down some of these sites, I'm also letting you know that this is a normal evolution, and it's planned actually and coordinated. And we're now looking at how can we get to that group 18 to 39 more specifically. And now as we're liberating staff, how can we reassign them to target those groups more efficiently and try to get the numbers up there, because that's what the next phase of the operation will be. It'll be a much more targeted approach with some of these groups to achieve better coverage in the areas that we have lower uptake. But I'd like to let Dr. Malotny talk, because a lot of this is really in the bailiwick and expertise of public health that they do every day. And so as this evolves more and more, the city will be drawing the normal operations, and public health will be taking more and more the lead in this type of work. So I'll let Dr. Malotny chime in.
Yeah, no, thanks, Tony. And just to add to your response, we really look at this at this point in the vaccine campaign as a rebalancing of our efforts. I mean, we're still going to have mass immunization clinics, but we need to increase. I mean, we've been doing it all along in terms of outreach, but we're going to have more targeted, micro-focused kinds of approaches where we're going to be going to where people live and they work or play or pray. And so we're going to, work with workplaces and businesses and organizations and places of worship to bring vaccine to people to increase our coverage rate. Because as I've said earlier, today it is critical that we continue to increase the number of people who are vaccinated in our city to be able to deal with the challenge posed by the Delta variant. Certainly, I think this concert is a good example where an operator wanted to to have more people vaccinated attending their venue, and so we're quite happy to support them and any others who want to pursue approaches or policies that are going to end up increasing the number of people vaccinated in our city, because that's ultimately what we need to be able to protect all of us, as well as to be able to have as many things as open and back to normal as quickly as possible.
Thank you. I'll just follow up as well with Dr. Maloney and Anthony DeMonte on the question of schools, I guess. So we're looking forward to the fall. Universities will be returning. Are you having conversations right now with those institutions about that 18-29 demographic that flood into schools in the fall, as well as if we're looking towards Health Canada approval for the below 12 age group, are elementary schools going to be involved in the vaccination campaign when schools hopefully restart in the fall?
So maybe I'll start, and a lot of this is for Brent, but the simple answer is yes, this is part of our planning. So to both your questions, for the colleges and universities, absolutely, that'll be, as Dr. Maloney just said, some of the targeted approaches that we're going to do, and we're going to work with those partners. And again, it'll be more and more public health doing that type of micro work, I call, but we'll be in there in support and less in the lead. And as well with the 5 to 12-year-old, the public health team is already, and the emergency operations center team are already devising plans to look at that, and that'll probably be a targeted approach, school by school, working with each of the schools to have clinics right in the school. So you can see how the shift is happening now, and as Dr. Maloney said, a much more targeted approach with partners, with community groups, and as we liberate the bigger mass vaccination sites, those assets now and resources can be focused on that to achieve that much more labor-intensive work, but extremely important to achieve our goals. So that's exactly where we're going. So it's a good preamble to what you'll be hearing in the next few weeks, and you'll see us moving towards. But Brent, I'll let you chime in more, because I know your team's been working on this a lot.
Yeah, no, thanks, Tony. I mean, a good answer. I mean, for sure, awaiting approval and of the vaccine for use in younger children. The exact timeline as to when that will occur in the fall, is not clear. I mean, we'll wait for Health Canada and the province on that, and then we'll be ready to go. But the planning is, discussions are already underway. And just to say that, I mean, we've been in the business of immunizing, school children for decades. It's actually an area that was gotten a little bit behind during COVID. And so we're also planning in parallel, how do we catch up with those school-based immunizations? And, those are things like hepatitis and meningococcal disease. And so those are important vaccines. So we also want to make those available to children. And so we'll be looking to catch up on those through the fall. In terms of the overall plan of preventive measures within schools, that will, ultimately be related to what the province comes out with in terms of guidance to all the school boards and public health units, and that's anticipated, in the coming week or so to be coming from the province. So we'll wait to see that in terms of how they are devising the return to school and the layers of prevention.
Thank you both.
Thank you. Nous allons maintenant passer.
We will give the floor to Julien Paquette from Le Droit. Hello, everyone.
For Stephen Willis. I know it's been answered during the meeting, but the answer unfortunately came when the YouTube feed broke down. So I just wanted to hear from you the answer you gave to Councillor Menard concerning the possibility of the air rights on the North Stand being attributed to one of the partners involved with OSEG.
So during the next stage of the process, when we bring the next report to council, we'll go through what the process will be to dispose of the air rights and get the revenues from the model, if that's what we ultimately decide is how we pay for the stadium. And we're going to get legal advice on this in the next stage about how we do it. There are processes to allow a single bid, and we validate that through ensuring we get fair market value for the taxpayers. We did that with the library, the disposal of the old main library, because there was really only one bidder in that situation. But we haven't ruled out other bidders at this stage, but we're going to bring that process forward to council.
Okay. Thank you. Ma question suivie, ce serait...
Follow-up question? This is for Mayor Watson. There has been a lot of discussion in the past week, I would say since the last fall, concerning the City of Ottawa Police budget. Some decision will be taken in the fall. So when you will be looking at a draft budget, the 2022 draft budget, do you think that the proportion will be reduced? Personally, I voted for the general orientation, and we are suggesting a maximum of 3% for the police budget. At the end of the day, it depends on the chiefs of police and the commission to present their own budget. Like I mentioned repeatedly, I'm not supporting a motion that will raise their budget. As a member of the council mentioned today, if we cut the 3% augmentation to the police budget, we'll have to let go about 120 policemen. I talked to different resident people in the different businesses. They're requesting an increased policing presence. We want to improve the safety of our cyclists and drivers. Thank you so much.
Right at the Ottawa Citizen.
Thanks for taking the questions. My first would be for the mayor. Mayor, I recognize you were elected on a promise to cap the annual taxation increase at 3%. We've heard also that we're in extraordinary times with the pandemic and opioid crisis, the housing crisis, climate crisis. Why not proceed with a slightly higher tax increase that would only cost the average homeowner, less than $100, say? The current 3% increase would cost, I think it's $120 additional dollars for the average urban homeowner. And that could go a long way to enhance the city's capacity to address some of the priorities that residents have been basically, begging for more help with.
Well, look, we've got a budget of close to $4 billion. And time again at budget time, we see lots of members of council who bring forward suggestions to spend more money, but rarely bring forward any ideas to reduce costs. You operate your own household budget, as I do, as every other citizen. There are expenses and there's revenue. And you have to make those balance every year. And sometimes after a difficult year, perhaps in employment circumstances, you don't have as much revenue. It means you're not spending as much on your household budget, whether it's fixing the roof or going on a holiday or buying a new flat screen TV or simply going out for a meal with your family. We have to show some degree of restraint, and the reason why I've campaigned on the last 3 elections on keeping the tax rate at a certain cap is because we have to discipline ourselves. If we simply just add more and more expenditures to the ledger and not bring in new revenue, we're going to find ourselves in a very precarious situation a few years down the road, because as you know, we're not allowed to run a deficit. So while it's nice to say everything is a priority, we know that when you go about that approach and you say everything's a priority, it really means nothing is a priority. You have to prioritize as to what we're responsible for as a city. We can't go and try to pretend to be the province of the federal government. We just don't have the fiscal capacity to do that. And so while it's easy for someone to suggest just put it up another point or two, the fact is you never get an answer out of those members of council who actually want more than 3%. They won't tell you what they want. Is it 6? Is it 7? When inflation's running around 2.5%, 3%, I think it would be completely irresponsible to our taxpayers and our residents, many of whom have lost their jobs and their businesses, to go beyond 3%. And I stand firmly behind that. I think the vast majority of people, I certainly got a strong mandate from the people of Ottawa to make sure that we rein in spending. And if you're going to go and spend another $100,000 on one project, you've got to find $100,000 to cut. And I know some members of council just can't stand that because it puts them in a fiscal straitjacket. But we need that. Otherwise, we go back to the old days. The previous council back before 2010 had fare increases, OC Transport 7.5% 3 years in a row. The taxes went up almost 5% for 2 years in a row. That's not acceptable. And I think what I've tried to do, and the majority of my colleagues on council, who I appreciate their support, have said we've got to give some direction to staff, and that staff direction includes what the maximum tax increase should be, so that it gives them some direction as to going and putting together the budget that we'll all have a chance to debate this fall. Thank you.
Thanks, Mayor. And my second question is actually directed for you as well. We heard the arguments today that the current budget directions and development processes, I think it was like a little bit lazy is the word that was used, especially considering the massive upheavals the city has gone through. Councillor Deans argued that she'd like to see the overall tax increase set at a lower level and for various city components to then justify their need for additional funds to try to better align spending with strategic priorities. What do you think of that proposal?
Sorry, I stand to be corrected, but I don't believe that she said she wants to see less than 3% increase. She may have been talking about the police budget, but she voted against the 3% cap, so the assumption is that she wants a higher increase. I don't believe that the budget process is a lazy process. I think our staff did an excellent job of pulling together all of the factual information that they believe we need to continue to provide the good services to the people of Ottawa. And so, during the budget process, people can go about and put forward motions. If they want to increase taxes by 5 or 6%, then they should have the courage of their convictions to stand by that and say, all right, I want to go spend more, and this is where I'm going to spend it on. I think the challenge, obviously, Councillor Deans is facing is with respect to the police department, because she's pulled in two different directions. She's got lots of activists and community members that want to see a freeze to the police budget, or in fact even a cut to the police budget. And then there are those people who want to see greater police presence and support for the police service. So they're going to have to, at the police board, come up with a decision and a budget that they will put forward to Ottawa City Council that we will approve or not approve based on the votes around the council table. Thank you.
Thanks, Mayor. And yeah, I'll go back and check. Sorry, Councillor Deans, if I mischaracterized your position.
Thank you very much. Next, we have Jackie Miller at the Ottawa Sun.
Oh, hi there. My question is for Dr. Malotny. As I'm sure you know, the Ontario COVID-19 Science Table released a school reopening report earlier this week, and it suggested that in areas with a low risk of COVID, based mainly on the amount and the prevalence of severe disease, and also the R rate being under 1, that masks and physical distancing and cohorting could be dropped. With some input from regional public health units. I'm wondering what you think about that, and under what conditions you would support dropping masks, physical distancing, and cohorting in Ottawa schools. Would that be this fall?
Yeah, no, thanks for that. And certainly this report that the Science Table did in partnership with the Children's Hospitals and some others, I think is useful input and useful, recommendations to predominantly government, because it's the provincial government that's going to set the plan for schools and identifying what the preventive measures will be. So I'm sure the provincial government is looking at what was in that report. I think some of the things that I've heard since the release of the report is a bit more nuanced in terms of what might happen in September versus at a later part in the year when we're reaching a more of a steady state. As per my earlier comments, I think the early part of the fall is going to be a potentially challenging time for us here in Ottawa and Ontario in terms of potential resurgence. Dr. Moore, the new Chief Medical Officer of Health, yesterday was referring to modeling that he has seen. And so it'll be interesting to be able to see that, and when it's public, be able to discuss that. So I think the sort of the low risk column, it probably fits when we're in a steady state and not potentially in a changing circumstance. But ultimately, it's the provincial government that's going to set what the actual requirements are for school boards and the expectations for public health units in terms of the investigation control of outbreaks, for example.
Okay, thank you. And my next question is for you as well. I'm wondering what you think of the idea of mandatory vaccinations for elementary and secondary school children in the same way that they have to be immunized for other childhood diseases. And could you perhaps explain how that could be accomplished? Would it require a change to the Ontario law on immunization of pupils?
Right. So here in Ontario, there is legislation that addresses the immunization of children in schools, the Immunization School Pupils Act, and it includes a number of important diseases for vaccination. And, there's provisions that, if, there are medical exemptions or if there are, for example, parental concerns, that there's provisions for educational sessions. And it's kind of a model that the provincial government adopted for long-term care workers, for example, more recently. I think at this point, we're really striving for voluntary immunization, and we've seen here in Ottawa that for youth, 12 to 17 years old, which is really the high school age, we've led the province in the uptake of vaccine, and we continue to encourage youth to be vaccinated. I'm sure parents are involved in those decisions to encourage that, and we want that strong uptake, and we think, that once a vaccine is approved for use in younger children, and those studies were started some months ago, and so when those results are in and it's approved by Health Canada, that there would be similarly strong uptake. And I think that there needs to be further conversation amongst provincial public health and local public health and others regarding whether the policies need to be in place to be able to assure high vaccine rates. But I think that ultimately the piece that's going to keep COVID out of schools is having low community transmission in the community itself, because what we saw last year was that the number of cases we were seeing in schools, that is the number of children or staff who were infected with COVID, was a direct reflection of how much COVID there was in the community. So protecting schools from COVID really comes down to all of us as a community in terms of keeping COVID numbers down as low as possible.
Thank you.
Thank you very much. Nous allons maintenant passer à Jérémy Bergeron.
We are giving the floor now to Jérémy Bergeron from Radio-Canada. Thank you. Mr. De Monte, you don't have a webcam. I would have loved to see you today. My first question today is for Mr. De Monte and also for Mayor Watson. I have a question. When you instated the emergency state, what were you allowed to do? And now that you've suspended it, what will happen? Tony will be able to answer that question for me. But Mr. Watson, can you tell us a little bit why did you raise or suspended the emergency state? It was a recommendation of our personnel. We're at the end of the state of emergency. There's a big difference between what we're doing, the suspending the state of emergency, and what Public Health of Ottawa will continue to do. So what it means is if we have a bid for some products and services, we don't have to respect the whole process when we have a state of emergency. Right now, we don't need that tool anymore, and that's the reason why we suspended the state of emergency. Thank you so much. So we started with the state of emergency. If we're looking at the COVID indicators, the thing is going very well in Ottawa. Vaccination is looking good also, and we have more and more citizens vaccinated. And we see that Ottawa has some of the best results. We also have the vaccination capacity. The number of doses is not an issue anymore. We have enough. And we're already in phase 3 at the provincial level. That's the reason that you receive these recommendations from personnel. And as you said, you do not need anymore to use the state of emergency to activate the buying process. So you can go back to what you used to do. And these are normally powers that we use only in a state of emergency, so you don't need them. We don't need them anymore. We're able to meet our objectives, so slowly we will just remove some of the tools. But I would like to tell you that the emergency center is still in operation. We're there because we do have public health objectives to reach. The only thing that changed are the powers. We do not need the state of emergency powers. To answer the second part of your question, what was it again? What were you able to do with the state of emergency regulation? We were able to hire over 3,000 people. 3,400 people were redeployed somewhere else as needed without giving them too much notice. So let's say that we needed someone at one place, the person is able to travel. Same thing for supplies. Remember, at the very beginning, it was very, very difficult to get any type of PPE. We had to go for a bidding process. It was complicated. And going through that process, when it was time to buy, the stock was gone. What will happen then? This is a normal evolution of our operations. What we did is we proceeded with more than 100,000 vaccination per day in our mass vaccination clinic. We don't need them anymore. The demand is not as high as we used to have. So we're slowing down our operations over there. Actually, this was planned and this was understood. So we will continue on that way, and slowly we may close down or slow down our operation at the emergency center. And public health personnel will go back to their regular activities, such as school immunization And if we do have a vaccine for the children aged 5 to 12, this will simply be done by the regular team at Public Health Ottawa. We will not need the mass vaccination centers anymore for that. It's just a normal evolution of the services. So right now we're dismantling the system and we're going back to our normal operations. And this will also be back to normal from the community. Thank you so much for your answer. Second question for both Watson and DeMonte. Do you think that residents will let go of physical distancing and masking and that we'll have a resurgence of the COVID? I trust the resident. We were still having a lot of activity in our vaccination center this weekend. Many are having already their first dose. So if we're looking at the group age 12 to 17s, we're the number 1 in the province of Ontario. But still, the pandemic is there. It's not finished. So there's light at the end of the tunnel. So if the population and the company and the businesses are respecting the sanitary measures, it will work. I'm very proud of what we've done. If we're looking at the other communities throughout Canada, sometimes they had issues with vaccination hesitancy. I'm not worried about that here in Ottawa. I would like to say that Mayor Watson is right. The pandemic is not over. We have to follow up public health recommendations. Of course, because we raised a state of emergency, it's only an administrative procedure. It doesn't mean that the pandemic is over. Like Mayor Watson says, I think the resident will understand this. Thank you so much.
We'll now go to Sue Sharing on the City from the Burbs. Sue, are you on the line? Okay, this concludes this afternoon's media availability. Cela conclut le point de presse aujourd'hui. Merci. Thank you.
Thank you.